Esophageal cancers involve the gullet, as we call it in layman's term. It is a tube that connects the mouth with the stomach. Patients who develop cancers of the esophagus, they can develop narrowing of the gullet, which results in difficulty in swallowing food. This is usually the main symptom which these patients present with. Initially, they would find that solid foods get stuck in the esophagus, and then progressively they are unable to swallow soft food as well as liquids. Patients who have esophageal cancers, apart from having difficulty in swallowing, can present with weight loss, regurgitation of food, as well as bringing up saliva, which pools in the esophagus and is usually brought up, especially as a froth in the morning. The diagnosis of esophageal cancer is based on endoscopic evaluation of the esophagus. This is usually done as a day case. Patients present to the endoscopy unit after fasting overnight. Most patients are given some form of sedation, and then an endoscope, which is a long tube with a camera on its tip, is passed into their gullet. This way, we are able to directly examine the esophagus, and we can reach the area where the tumor is. Through the channel of the endoscope, we can pass small biopsy forceps and obtain tissue samples. These are later evaluated histologically so that a diagnosis can be made. There are two different types of esophageal cancer. The squamous cell cancer tends to affect Afro-Caribbean people more than Caucasians, and is more common in men as compared to female. The risk factor for squamous cell cancer of the esophagus are smoking and alcohol. It is also common in certain people of certain parts of the world, and there is a esophageal cancer belt that runs in northern Iran, Central Asian countries, and central China. The second type of cancer is called adenocarcinoma of the esophagus. This type of cancer has become more prevalent over the last 3 decades. It tends to affect mainly males of Caucasian origin. It is related to chronic reflux and development of change in the lining of the esophagus from normal squamous lining to what we called Barrett's metaplasia. Barrett metaplasia is a precancerous change in the lining of the esophagus. It gives us an opportunity to keep such patients under surveillance, and if they develop early cancer, they can be treated earlier with a better outcome. Unfortunately, most patients with esophageal cancer present late when they develop dysphagia. Usually at this point in time, their disease is advanced. A very small group of patients would usually have early cancer. In view of that, it's important that we target screening at patients who are high risk, i.e. people who are over the age of 50, who have chronic reflux symptoms and are obese and of Caucasian origin. Such patients, we can diagnose Barrett's esophagus or early cancers. These patients usually enter screening programs, and they have serial endoscopies at intervals of 3 to 5 years. Studies show that such patients, when they develop cancer, usually are picked up at an early stage. These early cancers can, in a number of patients, be treated endoscopically by various procedures such as endoscopic mucosal resection, radiofrequency ablation, and endoscopic submucosal dissection. At present, the 10-year survival of esophageal cancer is about 15%. This relates to the fact that most of the cancers are detected late, and as a consequence, the disease has already spread to either local lymph nodes or distant organs, which unfortunately results in a poor prognosis. However, in order to improve the survival, it is essential that we try and detect these cancers at an early stage.